let's describe a tummy tuck.
Yeah.
Right? So you're going to make a incision that's hip to hip. And I try to bring it down above the, like right around the suprapubic or pubic area, because I like my incisions low.
Right.
I'm Brazilian, so I think of the Rio at the beach.
The lowest bathing suit you can.
Lowest bathing suits can
bring
be bathing
in
suits,
their
right?
bathing suits. So
Yes.
they want to say, this is the bathing suit I wear most of the time. This is where I want my scar put if you can get it this low.
Yes. And I ask people to bring that. If they do have a bathing suit, they like to do that. And I once did a tummy tuck on a person who competes in North Carolina for bodybuilding.
Yep.
And her main concern was to hide that scar. And I said, well, bring in your competition suit and I will mark your incisions within that competition suit. And she's been competing since, and nobody has seen that scar. And we fixed her diastasis because she's very lean and she had babies. So we fixed that, fixed her umbilical hernia at the same time. So she can look really snatched and make sure that the work that she was putting in was visible during these competitions. Right. So that was extremely rewarding, but it is difficult to do a tummy tuck with somebody whose percentage body fat is like less than 5%.
Right.
You know, very difficult, but it was amazing, you know, and having that healthy patient really helps. So you want to have also been close to your goal weight in your weight loss journey. So a tummy tuck, again, just like we talked about liposuction, is not a weight loss procedure. It's meant to take out the excess that was left after you've gotten close. I tell most of my patients I want you to be within 5 to 10 pounds of your goal weight.
Yeah, that's what I'd ask. If they lost more weight after, would it even make the outcome better?
Yes. And people do lose weight after liposuction like I did. Mm-hmm. I had a liposuction procedure, and afterwards it got me so motivated based on what I saw to do even better. But I had already lost like 14 pounds ahead of that. I had the procedure, and then I lost another 14 pounds afterwards. So it can propel you to even further weight loss. The downside of that, if you have surgery, is that you might have a little bit more laxity that we have to correct afterwards. But hey, you know, that's not a big deal. Like if you got to where you want to be in your body and we were part of that journey, then fabulous. But you don't want to be 20 to 30 to 40 pounds overweight, because it's not going to help you, especially if you concentrate your fat intra-abdominal, right? So inside the abdominal cavity. So if you can pinch it, I can suction it. If you can pinch it, I can remove it.
Right.
But if you do that and there's still some fat that's inside your belly, I can't go in there and get that.
Now, does the muscle tightening help camouflage that as well?
The muscle tightening does, but I have rarely found anybody that has had more than a 1 to 2 inch diastasis. The average I get is 1.5 inches. Mm-hmm. So you tighten 1.5 inches, that doesn't necessarily, you know, make
help
that
push everything
significantly better. But that tightening of the abdomen is what leads to the biggest complication, I feel, that could be life-threatening in a tummy tuck. So if you squeeze everything back in, that puts pressure in your intra-abdominal organs, and what's going to take the brunt of that is your inferior vena cava. The inferior vena cava is the biggest vein that you have in your body that returns blood to the heart. So you can get what we call venostasis. So a slowdown of the blood going through that, which can lead to blood clots in your lower leg. And those blood clots can travel into your lung and cause a pulmonary embolism. So I, again, talk to my patients a lot about hydration, about preventing blood clots. I personally check something called the Caprini score. It's a very well validated measure that assesses someone's individual risk of a blood clot. So our nurses during our preoperative visit go over that. If you are above a 7, then I'll give you anticoagulation. If you're below that, then we will discuss what the other measures are that will prevent it. If you're below 3, it's very rare. If you're in that in between 5 or 7, then there's a few other things that we can put into play to make sure that you don't run that risk. Have I had patients develop blood clots and a pulmonary embolism? I've had one of each. There were very special circumstances. One of them didn't know a past medical history. I do know some plastic surgeons that universally give everybody a blood thinner. The data shows that increases their bleeding risk from 2 to about 17%. So I prefer to be conservative because I don't want to put people at any other risks. But none of these is wrong. This is just different approaches to the matter. Mm-hmm. I think you just want to make sure you have that discussion with the patient and assess their risks and make sure that that's a good concern. And that hydration factor, that makes a huge difference. You want to be tanked up, not just for the fluid shifts, but also because it decreases your viscosity of the blood. Like, it's not as sticky.
Right.
So if you're well hydrated, that's definitely key.
So we've made the incision. We've opened up the area.
Yeah.
What are we doing next?
So we want to get to where your muscle fascia is. So we're right above the muscle. We want to lift all the subcutaneous fat off the muscle with your skin. We go around the belly button with a circle. So we release the belly button. In the majority of a traditional tummy tuck, I'll talk about when we don't do that in a minute. But we release your belly button, so your belly button gets stuck to where it is. Don't go anywhere. That stock sits right there. And you elevate until you get to the xiphoid, which is the bone right below your breastbone. So you're going all the way up to the ribs. You're lifting up that skin, subcutaneous tissue. And then you have access to the muscle. You can see if there's that diastasis or that widening in the middle. And you tighten that. People do it in all sorts of different ways. All of them work.
Yep.
Or don't work to the same extent, right?
And there's different sutures you can put
There's
in that
different
too,
sutures you can put on there. But essentially, the technique is the same. And the outcome on these individual surgeon variations, I don't think really matter. And then once you've tightened that, I use Exparel, which is a long-acting local anesthetic. It lasts 3 to 4 days. It helps decrease pain. It helps people move. So if you're moving and you're walking, then you're less likely to get a blood clot. So I love using that. I use that in all my patients. I will do a TEP block, which also helps with postoperative pain. I'll put it on the incision. So people think that the surgery is actually a lot better pain-wise than they thought it was going to be, or they have heard because of that. And then what we do is we get you in kind of like a beach chair position, kind of flex you on the table, so we can bring down the skin as much as possible and take out all the excess skin and make it nice and tight. And then I will put drains. You can do drainless tummy tucks, and I've done them as well. And if patients request them, I'll do it. I just warn them that it could be a little bit more painful because of the stitches we have to put to close down the space to the fascia, which is where all the innervation comes. So traditionally, I'll do drains. Drains are your friend.
Yep.
They've never hurt
last
anybody.
thing you want is the seroma hanging out, because it's going to take longer for your body to reabsorb it than it just coming out of a tube for the next few weeks.
Exactly. And we'll talk about the postoperative care and the things that you can expect afterwards in a little bit. But yeah, drains are your friend. People are scared of drains, but losing a drain prematurely or having one pushed back in like somebody did the other day to me are actually not good things to do.
Right.
They can render some problems. So just if your surgeon wears drains, great. If your surgeon doesn't do drains, then great too. Like, just understand like what the potential risk benefits of things are. But I do drains, and then I close it. I close with all internal stitches. You will never see a staple on any of my body procedures. I might put a staple somewhere in a scalp if I'm doing an endoscopic, like facelift or brow lift, but I don't do them in any body procedures at all. They'll all be internal stitches, and you won't see them at all. And I'll use a brown tape or steri strip on that.
I love the brown tape. I still use it on some of my excisions because I still run some stuff underneath for some people in areas that aren't pulling. I'm like, this is the only wound care you need is this tape for the next few weeks. And they're like, really? And I'm like, yeah.
It's amazing, right? It's just like 3M brown tape.
Yep.
Simple thing. You put it across the incision.
And it's sticky. It'll stick.
It will stick for 2 weeks really well. And then you can shower with it in place even the next day. It's porous in a way that it will take like moisturizing if you want to, but it's not going to cause any harm. It rarely traps any bacteria underneath. And then at 2 weeks, it usually comes off really easily without harming the skin. And then we'll start hydrating it for another 2 weeks, and then we'll do some scar gel. Belly buttons. Sometimes I can look at a cover of a magazine and see that somebody has had a tummy tuck because of their belly buttons.
Some people make the weirdest shaped belly buttons because they're just trying to make it back together to where it was. Yeah. Everybody in our practice, everyone I've seen looks really natural, the way, because everybody has their own technique.
Right. Yeah. I make my belly buttons like small because they widen a little bit.
Yeah.
And I really am very I guess I ask a lot of myself when it comes to belly buttons, and if they don't look as good as I want them to do, I'm going to bed and not sleeping because I'm thinking about that belly button. I can think of one right now where she had such an outie that I was trying to make an innie, and so whatever people want, we try to deliver it to them. Some people completely eliminate belly buttons and make new ones for patients, especially if they're doing something called a fleur-de-lis. So a lot of weight loss patients not only need the vertical, but they also need the horizontal skin tightening. So you have to make an incision down the middle, which people accept really well when they have that laxity. And I have lots of plastic surgeon friends that just cut out the belly button and make a new one within that flap. I try to keep it because I like to keep people's stuff as much as I can. But that's just me. But if you have to remove the belly button, you can. And some of the paniculectomy patients, I've removed belly buttons and just done the paniculectomy and come back and done belly buttons later on them.